I'm Alice Newland, the co-president of the League of Women Voters of Manatee County. Before we get started, I just wanted to remind everyone of a few housekeeping items. Please stay muted. Put any questions you have in chat to me, and if we have time, we will present them at the end of the conversation. This program is being recorded and will be available on our website and on our YouTube channel. You'll be emailed the link sometime in the next couple of days. Any use of the recording other than individuals viewing it must get written permission from the League. I'm going to start with a short summary of where Florida is today on reproductive rights. We currently have a 15-week abortion ban with no exceptions. This law is under review by the Florida Supreme Court. Oral arguments were in September, and we're still waiting for a decision as to whether or not that 15-week ban violates the Florida constitutional right to privacy. If, in the court's opinion, it does not violate that right, 31 days later, a 6-week ban with exception goes into effect. Studies by Floridians Protecting Freedom, that's the organization that sponsors the constitutional amendment, show that most voters are totally unaware of the impending 6-week ban. In response to the legislature's efforts to ban abortion, there is a citizens' initiative to put on the 2024 ballot a state constitutional amendment to limit legislative involvement in abortion care, now known as Amendment 4. Whether Amendment 4 goes on the ballot or not is dependent on a second Florida Supreme Court case, whether the amendment is of one topic and clear. The state argued the amendment is vague and should not go on the ballot. The Supreme Court must decide by April 1st. Typically, the court announces decisions on Thursdays at 11 a.m. So we theoretically can expect a decision this Thursday. If not, it will be required by Monday. We are very pleased to have joining us today in this conversation two practicing obstetrician gynecologists, Dr. Perron-Burdick and Dr. Sampson. Dr. Misa Perron-Burdick grew up in Nome, Alaska, and got her medical degree from the Warren Albert Medical School of Brown University. Practicing in San Francisco, California, and now Boise, Idaho, she supports low intervention birth and provides safe, patient-centered care. As a surgeon and a specialist, she also cares for high-risk pregnancies and delivery complications. Dr. Perron-Burdick moved to Boise 2 weeks before Roe was overturned. After the U.S. Supreme Court decision, Idaho quickly enacted an absolute ban on abortion, so she's on the front line of experiencing the impacts of the abortion ban on a doctor's ability to practice medicine and its impact on reproductive health care for the people of Idaho. Dr. Marian Sampson grew up in Mississippi and was a teen mother at 18. Her experience with her personal physician inspired her to become an obstetrician gynecologist. She graduated from Meharry Medical College in Nashville, Tennessee, and completed her obstetrics and gynecology residency at St. Petersburg Bayfront Medical. As a practicing OBGYN for 15 years and working with Planned Parenthood of Southwest Central Florida since October of 2022, she will bring to the conversation an expertise of the reproductive care needs of Florida. Our moderator, Barry Seidman, is an award-winning career newspaper journalist and opinion columnist for the Sarasota Herald Tribune. Carrie, thank you so much for taking your time and your lending your expertise to us today. Carrie?
Thank you so much, Alice, and welcome everyone. I'm very honored to be a part of this conversation. And you don't need to hear from me at all. We really want to hear from these doctors, so I'm going to dive right in. And Dr. Perron-Burdick, let me start with you. Let's start at the beginning. Tell us a little bit about your background, why you went into medicine, and what influenced you to specialize in obstetrics and gynecology.
Thank you so much. Can everybody hear me? Great, thank you. So I am what is called a late bloomer. I started medical school late in life at around 30, so I had a lot of time to decide what I wanted to do. I knew I wanted to do something that serves the community, and I'd always been very fascinated and interested in medicine. Once I started medical school, it was very clear to me that reproductive health was really important. I wasn't sure if I was going to approach that as an OBGYN or as a family medicine provider, and I actually applied for residency or training in both, and ultimately matched with obstetrics and gynecology, and it's been a very good fit for me. So I think that's kind of what brought me to reproductive health, and I think that working in San Francisco for 15 years was really an amazing experience. San Francisco has as close to universal healthcare as you can get. It has widely supported access to reproductive healthcare, whether that is pregnancy care, contraception or birth control, abortion care, transgender care. We kind of do it all. And upon reflecting, I kind of thought about the impact I wanted to have as I was getting into the second half of my career. And we have family in Boise, and just felt like maybe Idaho would be a good place to experience some new challenges, and maybe bring some expertise that I developed in San Francisco to the people of Idaho. That's me.
Thank you so much. We're really eager to hear. It's great that you have different perspectives from different places, so we'll be eager to hear about those differences. Dr. Sampson, can you do the same? Just tell us a little about your background and why you chose to go into this field.
Yes, absolutely. So she gave the little intro about me being a mom at 18, but I was also a school teacher for 8 years before I went to medical school. And like Dr. Perron-Burdick, I don't want to call it late bloomer, but I just had a nice detour because I also entered medical school at age 30. It was something I always wanted to do. But when you have a husband and a second kid and you got out of college and you're able to start working and have a home and all the things that check off the boxes for everyone else around you, you just kind of put your own dreams on the back burner. Well, one summer I was actually doing a summer like extra things that teachers do in the summer for enrichment, and it was related to medical genetics. And the professor there said, hey, what are you doing here? You're probably, needing to do something else. And I took the MCAT, and everything was kind of history from there. I did find out I was pregnant 2 weeks after I took the MCAT, which was important in figuring out, like, okay, what are we going to do now? So I entered Meharry Medical College with an 11-year-old, a 6-year-old, and a 2-year-old with my husband. So it was a long way around, but, it's satisfying nonetheless. Having the teacher background, I think, really helped me to understand women's needs in being able to listen and craft information for each individual patient, just as you would each individual student. Serving also in low income areas. I've had 2 positions with federally qualified health centers here in Florida, one of which I did serve as chief medical officer. So you do get to see all sides of it, the economic side, as well as the patient side. The administrative piece really does matter in how you approach your patients. And then finally, when Roe fell, at that time I was chief medical officer, and just something hit me that said, you need to get into that fight. So the very next day, that's when I put in my application to Planned Parenthood. And I said, I need to see about helping on this side. It turns out they did not have a position that I could do part-time near me where I was working, but they said, you know what? If you want to move, we can take you and we can take you on as full-time. So that's where I am. That's where I've been. And I really enjoyed the different patient interaction, very much like Dr. Perron-Burdick said. You get a different type of patient going into, like we said, the second half of your career.
Thank you so much. And we're going to circle back to the Supreme Court decision again, but so we'll get a little deeper into the impact that had on you. But it might be really helpful for our listeners to have each of you kind of explain what a typical week or day or month is like in your practice and the kind of range of patients that you see. And Dr. Perron-Burdick, we'll start with you, and you may have to give two different viewpoints because I imagine it's a little bit different now that you're in Idaho than when you were in San Francisco.
In San Francisco, I worked in our county hospital, urban kind of safety net hospital, if you will, and all of the patients were uninsured or publicly insured. And there I was actually the medical director of the clinic. And so on some days I would do administrative work. Dr. Sampson talked about looking at healthcare from different aspects, including administrative, regulatory, financial, et cetera. So that resonated with me. I would see patients in our gynecology clinic. Some days I would go to the operating room. Some days I would be on labor and delivery, and mostly I was working with trainees and residents, which was just really a joy, because it's really lovely to see the next generation of doctors coming up. And I think, so that's kind of what things were like there. And overall, it was, in hindsight, it's 2020, it was pretty low stress. I moved in a world in which, like during the pandemic, San Francisco was the first city to really shut down. And because of the AIDS epidemic, there was a very strong link between community organizations and public health and the university researchers. And so I was moving through this world being incredibly supported as a healthcare provider. I moved to Idaho, and I guess I'm now in private practice, although I do spend one day a week at one of the community clinics caring for underserved and underinsured people. The interesting thing is that I see a lot more people who are self-pay and have to pay out of pocket because the public health systems in Idaho, the public health care programs are not nearly as robust as they are in California. So I'm learning how to care for people who have to pay out of pocket and have no other choice. I guess I'm a little bit more in private practice, and so I see more people who are insured. But today I saw patients this morning. I went and delivered a baby by C-section. I'm back seeing patients. Now I'm hanging out with you tomorrow. I'm going to have a patient who had a miscarriage. I'll do a D&C on that patient, in addition to seeing patients throughout clinics. So it's just a little bit more all over the place. And I will say that, we'll touch on this later, but Idaho has lost 22% of its OBGYNs. And so it's actually really hard to kind of get bandwidth or get a breath of air and even do advocacy work. So I'm finding myself pretty exhausted all the time, trying to care for patients. Did that answer the question? Was that too long?
Oh, wow. I can imagine. Dr. Sampson, can you tell us kind of what your typical week is like, what kind of patients you're seeing, and what your practice is like at this point?
Yeah, so first, hats off to Dr. Perron-Burdick. I've seen and been through kind of, a taste of what she's talking about, being all over and stretched really thin. my heart goes out to you. So we're gonna keep you uplifted so that you can continue the fight that you need to do and to take care of you. Currently at Planned Parenthood, as being a full staff physician, staff physician, my days are kind of set up to where we're delivering either medical abortion care or procedural abortion care. Because Florida has the mandatory 24-hour waiting period, I definitely get to see everybody twice. Within there, I do have some complex GYN patients because, again, Planned Parenthood is not only abortion care, we care for the whole individual. I'm also on site when our GYN providers, who are nurse practitioners, when they're also seeing male and female patients for STD screenings, for annual exams, for even PrEP. They're doing all of these things. And so I'm the physician consult that's on site as well. So even though I'm not directly handling that care, I'm still, in touch with what's going on. My patient base, generally, because abortion care is not provided for under insurance, the majority of them are self-pay. We do have monies that the community has been able to pull together, not only for patients who qualify through our Justice Fund, but also patients for long-acting contraception, as well as birth control pills, short-acting as well. So I also place IUDs, remove Nexplanons, place Nexplanons, the implants. We do all kinds of STI counseling, as well as the birth control counseling. Mainly, it's we try to create a one-stop shop. When the patient comes in, we want to assess as many needs as we possibly can and try to get all of those taken care of. And to link back to something that you asked earlier, what made me want to do OBGYN? It was specifically that. When women need to be seen, they need to be seen. They've been taking care of everyone else. And when it's finally time for her to be seen, we want to address as many things as possible. Sometimes I have to counsel and possibly prescribe medications for patients' blood pressures. I do definitely give them advice related to their anemia, what their next steps would be. So all of these things that come into play are very important in going beyond what people perceive as just abortion care. And we actually try to take care of much of the patient as possible, and they completely appreciate it. Those 2 little visits can be very impactful, and that's a great thing. It's very, very rewarding. Also, some of the patients, the majority, I should say, about 60% of the patients that I see for abortion care are already mothers. So they're best equipped to make the decisions that they need to make for their families. And we're here just to assist in whatever decision they choose to make. I usually tell patients I can prescribe an abortion pill or I can prescribe prenatal vitamins. Same breath, same pen stroke, no different. It's up to you, because we're here to support whatever you need.
That sounds like a wonderful approach. I'm gonna skip around a little bit in my questions just because I think this is so pertinent to some of the things you're talking about right now. But I'd like to hear, what was your immediate visceral and physical response to when you heard the U.S. Supreme Court was going to overturn Roe versus Wade? And I'm going to start with Dr. Sampson, since it seems to have been quite a catalyst for you.
Yes, Carrie, it really was. When you say visceral, there's no way to underestimate it. Even though I am a menopausal woman with a tubal ligation on top of that, there was something about it that said, somebody's trying to boss somebody around and they don't need to do that. And it was just an issue of, I can keep doing the office work. I can keep doing the administrative work. I can keep doing the work, but it was like a bell rang. And it was like, somebody really needs you to help here. And that's just where you need to be. I can't explain it any further than that. It was really a calling that said, and I had never really considered full-time abortion care ever in my career. When you set out to be an OBGYN, the OB comes first. And everybody thinks of you as, oh, my doctor who delivered my baby. And I have a ton of those patients, lifelong friendships now, because I can see those kids grow and you still take care of the moms. But there was something about, there's a whole nother population of people who right now just don't want to be a parent or want to be a parent. And now we have a fetus that can't survive. We have a fetus that didn't grow a brain. And this was an IVF baby. We get those. And I was one of the doctors in my office who, when a patient had a fetal anomaly, where did I refer them? Planned Parenthood. That's where I referred them. So I realized that I had used this resource and never really considered my contribution to that resource and how that could be fostered and help later on, because it wasn't in jeopardy. It wasn't threatened. And now it is.
And did you, at the time that you made the decision to go full-time to Planned Parenthood, did you think at all about the repercussions of your choice? Were you fearful at all? Were you hesitant?
Anyone who knows me will tell you no. She does what she wants to do. And she's already thought about it from 5 different angles. And it's when it's time to get into a fight for something, it's time to get into a fight for something. That's just that's the cloth I'm cut from.
That's wonderful. Thank goodness we have people like you in the medical field. Dr. Perron-Burdick, if you'd answer the same question, just bring us back to the moment you heard that the Supreme Court was going to overturn Roe versus Wade and your response.
Well, first of all, I thank you, Dr. Sampson, for sharing that. I think that I had very similar feelings, and I too, my partner likes to say that I like to poke the bear. So I understand the fight. So I will say that I think that it was one. I actually think that moment when I heard that Roe was being overturned was really definitely disbelief. But really, when I think about what life was like before Roe, that was about 2 years before I was born. That was very kind of, what are the words that I'm looking for? A little esoteric, like not real life. And living in San Francisco, I'd never experienced any type of restrictions whatsoever. And as a person that carries a ton of privilege because of my race, my financial status, my language ability, etc., I've never moved through a world in which someone has told me I can't do something, or it's not been difficult for me. And I think that it wasn't really until I had already made the decision to move to Idaho at that time. And I actually did not do abortions when I was living in San Francisco because I was surrounded by so many providers and there was a ton of access. But once I had knew I was going to move to Idaho around the same decision, that it was about the same time we knew Roe was falling, I made the decision to get trained up to become an abortion provider. And so I think I definitely, I had other reasons to move to Idaho. I don't know that I would have done what Dr. Sampson did or had been as brave, like to pick up my family and move my family to a place for a job to specifically perform abortions. But I definitely had this feeling of like, I can be useful in this way. And I think that was important to me. But I think a lot of it, looking back on it now, boy, was I pretty ignorant on what it really meant to have Roe fall. It's been a bit of a journey.
And did you think at that time at all about the repercussions of your decision to perform abortions?
Yeah, I mean, I definitely was wondering about the safety of my family. Idaho is known for guns. Among other things, we chose to live in a we are able to live in more of a liberal part of the city that's also really expensive. So that's kind of where my privilege shows up, is that I can choose a neighborhood that we walk around and we know that we're supported by people who share beliefs with us. But, another thing was I've got a 7-year-old and an 11-year-old, and my 11-year-old was um, on her on a field trip, and I wasn't able to accompany her. And she was explaining, and so I still go back to California to perform abortion so I can keep up my skill. And right there, in the field trip, she was explaining to another parent who I'd never met. School had been in session, new school, new city, never met these people. And she's like, "Yeah, my mom would have come and chaperoned this, but she's in California doing abortions." Right in front of, and fortunately we live in this neighborhood where it's really supportive. And so but it is there, I think about what kind of blinds I put on my windows. Like right now I have kind of sheer blinds, and I'm wondering if I should really, as I do more advocacy work and my name gets out there, should I change that? Do I need to take other security measures, etc.? So um, but overall I've been okay, I think.
I'd like to ask you each to consider what misconceptions you've encountered about abortion, whether by patients or or acquaintances. Tell us what fallacies you've encountered, Dr. Sampson.
Yeah, so I don't know if it's false information that from the people that I've encountered. I think it's just incomplete information. I even had a patient just last week who, she chose to open up to me and say that she was pro-choice, pro-life up until it happened to her in her 40s. And she just said, I never thought I could get pregnant in my 40s, and I'm very responsible. And so, well, this isn't an issue of irresponsibility. So this is an issue of, there's an IUD in there and a fetus. I have patients, again, that I mentioned before, you have a family who has undergone IVF. They're paying $10,000 per round to have a baby, and to have to be the person to sit across from them and say, we're sorry, it's not going to survive. And you're not the first doctor to tell them. You're not even the second doctor to tell them. You're the third doctor to have to tell them that, because of the way the laws are structured in Florida. Those things, when I share that with people in my immediate circle, they turn on the light bulb. They're like, "Oh, I never thought about that." Said, there are all these other possibilities where you have an ectopic pregnancy, or something that looks very much like an ectopic in terms of its chemical nature, and you can't really physically see it yet, but you have ER doctors who are afraid to act upon it based on the way that the laws are structured. Well, by the time you actually see it, her life is in danger. And it's not a matter of, oh, well, we got time, we can wait on it. That's a problem. I will say that the misinformation, the little bit of misinformation that or I should say misguided information that gets out there is some of the pregnancy care centers that kind of disguise themselves as, we're going to do your ultrasound. And I have heard, I don't know if this to be actually true, but I have heard from patients that they received a different due date. They received a due date that, had they followed it, it would have led them to not act until it was beyond the 15-week Florida limit. And that's the little bit of deception that comes into play is an issue. I fully understand why the people who are against abortion why they feel the way they feel, but I feel like they're incompletely informed. And just to kind of tag back with what Dr. Perron-Burdick said, I didn't move my family because they're all adults. I only moved me and the dogs, so that you can take my bravery notch down just a little bit. It was really just me. And I am now. I will say I live in the middle of a very conservative county and city. I do take my own personal protection very seriously. And Planned Parenthood does a very good job in training all the staff on just general community things and how to look out for yourself and, basic stuff that we do all the time. But no, you can take my bravery notch down a little bit. It's just me. Nobody was in trouble.
We think you're both brave. Dr. Perron-Burdick, can you answer that same question? What kind of misconceptions have you encountered, if any, about abortion?
I have to echo Dr. Sampson 100%. It's kind of like people cannot believe that they would need an abortion until they actually need one. I think it's hard for people to wrap their heads around this idea that they might be in a situation in which their life is at risk, or they have a pregnancy that's not viable, cannot live outside, would not survive. And it's not until somebody or someone very, very close to them has one of these experiences that they really realize why access to safe abortion care is so critical for families. So I agree with that. It's kind of like this idea that this law will never affect them. And I held that belief as well. And, the other thing that we hear a lot here is that abortions are reversible. Definitely, the so-called crisis pregnancy centers tell that to patients, that abortions are reversible. I have physician colleagues who are not OBGYNs who have attempted to get abortion reversal protocols in place in emergency rooms here. So that's another thing that I hear. One thing that I also hear a lot is that, so Idaho is a state that criminalizes physicians. So when I am in a situation in which I might need to do a procedure on somebody, I'm kind of faced with this decision of, do I break Idaho state law or do I break federal EMTALA laws? Do I break Idaho laws by doing a D&C in case someone's really hemorrhaging or bleeding, or do I break EMTALA laws by not providing that care? And then we don't even get into medical ethics and my responsibility to patients. But a lot of patients, and I've explained this to patients a couple of times in as sensitive as a manner as I can imagine, as I could do. And I have had at least one patient, I've had a couple patients actually walk away feeling like the patients experience delays of care. So oftentimes we have to wait until there's no cardiac motion to actually treat these life-threatening conditions. And so patients walk away feeling like they got substandard care, which, to be honest, they did. But they also feel that it's my fault, and that my decision to follow these laws is motivated by politics, or that I could have decided not to follow the law. So I think the other misconception I run into is that when these laws result in poor patient care, that it's actually the physician's fault.
Dr. Perron-Burdick, will you go into what an EMTALA law is? I mean, we know, but the rest of the
Yes, thank you. Yeah, so this is a federal law that means that any hospital or institution that has Medicare funding is required to provide emergency medical care to protect the life of a patient. And in Idaho, we initially our complete abortion ban actually said that we couldn't follow EMTALA. That was taken to court. We were able to reinstate EMTALA laws. And so patients are protected under EMTALA laws if they're receiving care in an emergency room or on a labor and delivery floor. And so then, unfortunately, the protection from EMTALA was taken away from us again. And that's actually coming up in a Supreme Court case of Idaho versus the Supreme Court. So basically, it doesn't matter your ability to pay, who you are, where you come from, what you do if you walk into an emergency room or a labor and delivery, there is a federal law that says you must receive health care. Is that a good summary, Dr. Sampson? Would you add
You got
anything?
it. Yes, perfect.
Yeah, thank you so much for explaining that to all of us. And I feel so honored that we have both of you to provide perspectives from different states. So this next question, if you can kind of focus in on your own experience in your own state, and that's, what impact have abortion restrictions had on the availability of maternal care in your state? And Dr. Perron-Burdick, why don't we start with you, because I know you mentioned previously that there's been a loss of providers. You're muted.
I often speak while muted. I apologize. I
No
feel like my spouse would love to mute me more often. So we have lost about 20% of our workforce that provides pregnancy care. And that's a combination of family medicine physicians who provide obstetric care, midwives, or OBGYNs like me and Dr. Sampson. We have had, I think to count now, 4 hospital labor and delivery shut down. So I work about 15, 20 minutes outside of Boise, and my patients come from as far as 2 to 3 hours away because they don't live near a hospital that provides labor and delivery care. I think one of the most critical losses that we've experienced is within the field of obstetrics and gynecology. There are specialists called maternal fetal medicine physicians or perinatologists or high risk obstetricians. They do training like me and Dr. Sampson, but then are crazy and do an additional 3 years specifically to take care of women with complications. And so when women are diagnosed early in pregnancy or second trimester or third trimester with high-risk medical conditions that put the pregnant person's life at risk, or conditions of the fetus of the pregnancy that puts that makes it non-viable. It's usually these high-risk maternal fetal medicine physicians that take the lead on counseling patients and discussing their options with them. And when I moved here a year and a half ago, we had 9 maternal fetal medicine physicians, and within 9 months we lost 5 of them. And so, we have 4, and then some. I think we might have just hired one. One of our hospitals hired one, so we have 5 of these physicians for the entire state of Idaho. And so it's really hard if you have a high risk pregnancy to access this care. And I think it's really important to acknowledge that what happens is that, there aren't many OBGYNs. My schedule's really full. If I have, a postmenopausal woman who's 65 or 70 who's had vaginal bleeding unexpectedly, that's a risk for cancer. It takes her months to get in to see me. So it's not just, people not being available to take care of women or people who are of the age of reproducing, reproductive age women. That's the smart way of saying that. But it's your grandmother who, might have a growth someplace that's turning into cancer that can't get in to see a doctor. Because we OBGYNs are so full, more of our family medicine doctors are trying to see more patients, but it means that they can't see other patients who might have high blood pressure, heart conditions, etc. And so this crisis doesn't just affect women, people who have uteruses. It affects healthcare everybody. I have this op-ed in my head that I'd like to write. My father-in-law was admitted to the ICU for cardiac problems because it took him so long to see his cardiologist. And his cardiologist was so busy because he was seeing patients for more primary care patients because the primary care doctors are seeing pregnant patients. It's just this snowball that affects every person in Idaho.
Wow, that's really distressing. Dr. Sampson, how about Florida? How have you seen the availability of maternal care change?
Yeah, so we have the same thing going on, but it's kind of reversed. So because the other states surrounding us have very limited abortion restrictions, very restrictive abortion restrictions, restrictive abortion laws, where did they come? They come to Florida. So my schedule is completely full, just like she said, with the patients who need the abortion care, but we're the only ones who can do that. So we end up packing our schedule as much as possible to try to see all of these patients. And I service 2 areas. I service the Fort Myers area and the Naples area. And then if need be, we will travel all, because we're the affiliate for Southwest and Central Florida. So I've worked as far as north as Orlando, all the way down to Naples. And so sometimes it's cute when patients say, "Oh, you're the lady in Naples. Oh, you're the lady at Fort Myers." I say, "Yes, there's not a lot of us to go around." But I feel what Dr. Perron-Burdick is saying in terms of it bleeds over into other things, because I have a lot of patients who need to have cervical things taken care of, like precancerous conditions, or they need what's called a LEAP procedure. So they go to see the nurse practitioners, get the pap. If the pap is abnormal, they perform a colposcopy and a biopsy. And then if they need a procedure, then we try to get them on the schedule to do that, especially with them being uninsured or underinsured, because we're going to be cheaper than doing it at anywhere else. And this is something that's of a time sensitive nature. We're trying to beat it becoming a cervical cancer, but we got to find time on the schedule to do it. So just like she said, there are things that could be handled if you had enough space, the basics, the things that we would consider, the basics, but it's being flooded. The time is being flooded by these things because people have nowhere else to go. We get them from out of state all the time, and they have to stay because of the 24-hour waiting period. So again, that's 2 visits on our schedule. It's not 1 visit and you can be done. Everybody has to have 2. So that restriction alone has doubled up the full schedule. It's completely doubled. The only other thing I would say, I guess, in terms of impacting other types of patients, is just like she was saying, you kind of end up doing things that are beside or adjacent to what you would normally do. It expands your skill set, that for sure. You expand your skill set, but it's still something that you feel like you're not giving the patient the full entire range of the care that they deserve.
Yeah, let's follow up on that a little bit. I mean, just listening to what both of you deal with day to day is overwhelming to someone who isn't even in the medical field. Have the implementation of these restrictions made you reconsider your profession, or do you hear concerns from other providers about, I can't, this just isn't sustainable? Dr. Sampson?
Yeah, now we hear that. And again, we've learned I think COVID has helped us to hone in when we hear other providers. We've learned to, I think, recognize those early signs of burnout. Just like with Dr. Perron-Burdick, some of the things that she said earlier about what she goes through, those rang, alarm bells for me. So we try to form, support for everyone. It has not deterred me. I get more fired up about it because I usually have a patient every day that will sit right there in front of me and is so appreciative and is so happy for the care that she's going to get. And she says, "Thank you for giving me my life back." When you get that, it's not going to matter what else is going on. I'm going to do what's within my legal rights and what's within my own physical ability to do to take care of these people. They're not going to be on Facebook with this, "Oh, my OBGYN so wonderful. Look, she delivered my baby." But we're not going to get that. The edification that I'm going to get is purely one-on-one. And that's more than enough for me.
How about you, Dr. Perron-Burdick?
So I travel back to San Francisco every 2 months to work in an abortion clinic, and I will say that that fills my soul so deeply and kind of gives me what I need to come back to Idaho. I think when I'm in that environment, it just feels like such an act of commitment and compassion that really focuses on the patient. And so that what I think what Dr. Sampson says about providing abortion care really resonates for me. I think right now I'm definitely wondering if whether or not this staying in Idaho is something that's good for me or my family. I'm looking at kind of recreating my job in a way that where I spend more time filling my cup instead of emptying it. Um, and I think the hard thing is that um, Dr. Sampson, you really picked up on my kind of. I'm also think I'm fighting a small case of pneumonia, so that may not help. But um, I I don't know. I think it's where it's wears me down, and I think one of the things that's really hard is that um, in the state of Idaho, we have two major hospital systems, and one of the hospital systems is Catholic. And so, if I can't work to kind of craft a job that fills my cup more than it drains it, I don't have any other place to go in the state of Idaho because the Catholic institution would not hire me. Um, so I totally lost track of your question because now I'm kind of like getting inside myself.
Oh, but
um,
just wondering if you had,
yeah,
if this all has made you reconsider your
yeah.
commitment.
Not my commitment, not my career. I am so blessed to be an OBGYN and to work in all these different facets of caring for people. But I think there is an overlap. But I am wondering if staying in Idaho is sustainable for me. That's where I am right now. So I'm worried that I'm going to be the 59th OBGYN in Idaho to leave. Um, but maybe I'll tap into a job. Maybe they want to hire me in Florida. I'll go work with Dr. Sampson.
We got you. Come right on. We
Thank
are
you.
ready. You like Universal, Orlando, you got all the theme parks. We got it. We got a spot for you.
Yeah.
I love action movies. I think I'd love it.
This time is just flying by, and it's been fascinating and inspiring to listen to both of you. I want to give you each a minute just to share any concluding thoughts or remarks you might have. I personally would be interested in knowing how we as just general citizens can support you. Dr. Sampson, any last thoughts?
Yeah. So what encourages me is seeing things like the ballot initiative, seeing events like this where people want to hear. And what I challenge people to do at any event that I speak at is I don't really have the capability to go out and cross the patient doctor line and talk to, so I have my little circle and they're all supportive of me. We're all on the same page. We need to get people who might not be even in our same book, let alone same page, but the information that you all gather from us is something that you can take back. And if you start to feel differently about it, then you can definitely help someone else to feel differently about it. And that's how change really happens. It's going to be one person at a time, just like my patient who came last week, who was pro-life, who is now a little bit 50-50 because she herself needs a procedure. I told her, I said, it doesn't mean you don't have to be pro-life. It just means you understand that there's an option that someone else may need that you hadn't thought about. And I said, if you feel comfortable talking to me about it, hopefully you will feel comfortable not necessarily sharing your experience, but sharing your new viewpoint with someone else. because that's how we're going to win this. We
That's a-
have to win it one by one.
That's a great point, a great point. Alice, I just want to give Dr. Perron-Burdick a
Absolutely.
chance for a last comment, and then I'll throw it back to you.
Well, first of all, I just am so honored to be on a call with Dr. Sampson. One thing to note is that the states that surround Idaho have seen a 20 to 40% increase in the number of abortions they're providing. And I imagine that a lot of those patients are from Idaho. So thank you for doing that work. And keeping that access line, like when I call these clinics and ask for help, I always get a yes. And that is just such a deep lifeline. I agree that a lot of the change happens one-on-one. I come from, on both sides of my family, very conservative Catholics, and I think that because of our mutual love and respect for each other, we've been able to have conversations that have helped people think differently about this thing. So again, echoing Dr. Sampson, that a lot of it is one-on-one, and most physicians don't have the bandwidth or the time to get on the political side of this, and without the work that you're doing, I don't think anything would change. You guys, we may be providing on the ground services, I'm providing on the ground services, but really the change for everybody is going to come from you guys. So please, please, I don't know how you have the energy. I don't know how you have it's really confusing. Politics are confusing. I just learned what a ballot initiative was. So thank you for your interest and your expertise and your work. That buoys me. Thank you.
I absolutely agree. You ladies are fantastic. And you gave me a new friend.
Well, I thank you both so much. It's been an honor to speak with you. I'm going to toss it back to Alice now. And I think maybe, I don't know if we have time for questions from the audience or.
Oh, I think that horse is out of the barn.
Okay.
Yeah, but I echo Carrie's really heartfelt appreciation for your participation. And it's just, I mean, you just both speak so from the heart, and it's wonderful. And Carrie, you've done a fantastic job. So thank you for your participation.
My honor.
The League of Women Voters is a nonpartisan political organization that never takes a position on a party or a candidate. We do, however, after careful study and consensus, take positions on issues. We believe protection for reproductive health decisions is a democracy issue. Without the ability to make reproductive decisions for one's own body, women and those who can become pregnant cannot participate equally in our democracy. This will exacerbate societal inequities and fall disproportionately on people of color and low-income communities already facing egregious obstacles to health care. The Florida League is one of the partners with Floridians Protecting Freedom, working to get Amendment 4 on the ballot and have the amendment pass. As we have heard from today's conversation, for the sake of families and the people of Florida and for their life and health, it is imperative that we get Amendment 4 passed. In 2023, there were 84,000 abortions performed in Florida. It will be impossible to absorb that need if Florida bans abortion at 6 weeks, which is essentially banning abortion. The bar is very high because Amendment 4 must pass by 60%. I thought it would take a miracle to get enough petitions to get any citizens initiative amendment on the ballot, especially in less than a year. We started collecting petitions in May. But through hard work and lots of money, we got that miracle. The forces against abortion rights have been collecting donations and working out their own strategy, painting this basic health care as extremist. Our own state government is against the amendment. It will take a miracle to get 60% of the voters in the general election to vote for Amendment 4. We can get that very, very important miracle with hard work and lots of money. I'm going to bring up, I'm going to do a screen share here. There are a couple things coming up. Oh dear, that's not in. We want to go. That is not weird. Okay, there we go. There's a rally to kick off the Citizens Initiative. It's going to be in Orlando on April 13th. There are in St. Lucie, Seward, Palm Beach, there are busloads of people going. We have people going from Manatee County. And if you email info@LWV Manatee, we need lots of people to show up. It is being touted as a rally to end the 6-week abortion ban because of exactly what I spoke about earlier, where most people are totally unaware that there's going to be a 6-week ban. And it's really very likely that that's going to be the case. You can go to FloridiansProtectingFreedom.com and you can sign up for their communications. You can volunteer, you can attend their events, and I'm going to go over one more, and you can donate because they do need money. You can also go to the League of Women Voters of Manatee County's website, lwvmanatee.org. You can sign up for our communications on the homepage. You just scroll down. You can volunteer. You don't even have to be in Manatee County to be part of our group that is working very diligently to, we worked very hard to get it on the ballot, and we're going to continue to work to get it passed.
And Alice, I'm going to be at that rally.
All right. You go, girl. There's going to be a Super Saturday, and this is where it is right now, where and primarily it's going to be events where there's going to be instructions on communications, on outreach, on things like that. It's a real kickoff to get people to to really able to effectively communicate, and also to give them the tools they need. So I'm going to stop the share now, and can we stop the recording? And